Welcome back, friends. Welcome in the continuation video of Mycobacterium tuberculosis. In the previous video, we have talked about how Mycobacterium tuberculosis makes the environment inside the macrophage for itself survivable, right? And that ultimately cause primary TB in some bodies, right? Now we will going to discuss how immune system try to protect us. Okay, along with that we will going to complete today all the things that is going on in the pathogenesis of Mycobacterium tuberculosis. So let's start. So in previous video we have talked about up to the primary TB, right? Now after 3 weeks of this incident, our cell mediated immunity comes into the picture. Cell mediated immunity means the immune system which is consist of T helper cell and cytotoxic T cell, right? So what they will do, first of all, those immune cell will surround the site of TB infection, okay, and forms a special type of formation called granuloma, okay, and it is nothing but a effort to prevent bacteria from spreading to rest of the part of the body. Okay, so what is the first step after immune system comes into the picture? All the immune cells will surround the site of TB infection, okay, creating granuloma, which is nothing but an effort to prevent bacteria from spreading. Okay, now the tissue which is in the middle of the granuloma starts to die via a process called caseous necrosis. Okay, sorry. And caseous necrosis means cheese like necrosis. You know what, why this kind of necrosis is named as caseous necrosis? Because caseous means cheese like, and most of the died tissue are kind of white, soft, and have a cheese like appearance, and that is why this kind of necrosis are named as caseous necrosis. Okay, so via this caseous necrosis the tissue inside the middle dies as a result of this. Okay, and now this area is known as gone focus. So the definition of gone focus is very important for Mycobacterium tuberculosis. You can expect a short question in the form of gone focus. So that is what I have written here. You can take a screenshot of this. About 3 weeks after initial infection, cell mediated immunity kicks in and immune cells surround the site of the TB infection, creating a granuloma. That I have told you, that the immune cells surrounds the site of the TB infection, okay, which is essentially an attempt to wall up the bacteria and prevent it from spreading. Now the tissue inside the middle dies as a result of caseous necrosis, and it is named as caseous necrosis because it produces such type of tissue which is white, soft, and looks a bit like cheese. Okay, and this area is known as gone focus. Okay, so this is how gone complex will look like, gone focus will look like in chest X-ray. So now let's move. So we have talked about up to gone focus. Now let's talk about what will happen. Now let's see what happens. So we have discussed that primary TB infection occurring in the lower lobe. So this part is lower lobe. So from that lower lobe, the gone focus will gets to the hillier lymph node. Okay, it may be transferred via immune cells through the lymph or by direct extension of the gone focus. Okay, and in the hillier lymph node they causes caseation. Okay, and this caseating tissue along with associated lymph node are called gone complex. Okay, so that is what I have written here, that TB can also gets to hilar lymph node. Okay, you can also talk about that the TB bacteria after causing gone focus, it will travel to the hillier lymph node. Okay, either carried over by immune cells through the lymph or by direct extension of the gone focus infection. Okay, causing caseation and together the caseating tissue and associated lymph node make up the characteristic Ghon complex. Okay, Ghon complex is usually subpleural and occur in the lower lobes of the lungs. This is very important for MCQ purpose, that what Ghon complex is, either it is pleural or subpleural. So your answer should be subpleural, and it is occur in the lower lobes of the lungs. Okay, remember it that whenever we are talking about primary TB infection, make sure that everything will be occur in the lower lobes of the lung. Okay, there is no doubt about this. But when we will talk about reactivated TB, it will be in the upper lobe. Okay, so we have talked about Ghon complexes. So after interruption of immune cell, the first thing that is formed was granuloma, right? And from granuloma via caseous necrosis we have Ghon focus. Now in the hilarial lymph node we have Ghon complex. Okay, so this is the sequence you have to remember. Now after that, the tissue encapsulated by granuloma, because it is obvious that granuloma is still present here, inside which due to caseous necrosis our Ghon focus forms, right? And Ghon focus in the hilarial lymph node converted into Ghon complex. That means granuloma is still there, right? Now the tissue inside the granuloma undergo calcification and fibrosis, producing a scar tissue. That is very important. Remember this term, scar tissue, that can be seen on X-ray, and this calcified Ghon complex is known as Ranke complex. Okay, that means the tissue which is still present inside the granuloma undergo now calcification and fibrosis. Okay, and produces a scar tissue that can be seen on X-ray. This calcified Ghon complex is known as Ranke complex. Clear? So let's see how the chest X-ray will look like in case of Ranke. So I have taken this chest X-ray image from Google. So these are the X-ray image for Ranke complex. Okay. So up to that part we have seen that first of all macrophage will ingest the TB. Okay, and inside the macrophage TB will make an environment which is suitable for itself. Okay, now immune system will kicks in, and immune system try to surround the TB site of infection. Okay, and facilitates caseous necrosis. Now this after surrounding of immune cells we have granuloma, right? This formation is known as granuloma. Then caseous necrosis we get Ghon focus, right? Ghon focus then go to the hilar lymph node and causes Ghon complex, and from the Ghon complex, due to the tissue which is still encapsulated by granuloma, undergo calcification and fibrosis and produces Ranke complex, and Ranke complex consists of a scar tissue. Okay, so this is the sequence you have to remember. If you can take the sequence in your grab, then it will be very easy for you to understand the pathogenicity of Mycobacterium tuberculosis. Okay, so now from that part there can be two possibilities. One is only the scar that I have mentioned will left, and the entire microbacteria will be killed by the immune system. Okay, and that will be the end of the story. And other cases mycobacteria remain walled off by the immune cells, but they are dormant. But that means inside the immune cells they are still alive. Okay, and once the immune response become compromised, or once our immune system gets compromised, that can be due to AIDS or aging, they become activated. Okay, the Ghon focus now again become activated, and they try to spread to the either one or both the upper lobes of the lungs, and this is known as reactivated TB infection. I hope you remember about this chart that I have discussed with you, that when immune system gets compromised, the tuberculosis can become activated again, and this infection is known as reactivated TB infection. Okay, and this is due to the compromisation of immune system. And I have also told you in, let's say, wait a minute here, that in primary infection the first choice for TB is the lower lobe of the lungs, and in secondary infection, or you can say reactivated TB infection, the choice is upper lobe, because upper lobe prefers a good V by Q ratio. Okay, which means that a extra O2 and a ventilation present here. Okay, this is very important. So here what I have sorry, reactivated TB now prefer the upper lobe. Why I have told you? Because it will get a greater oxygenation, and being a obligate aerobe, it is very necessary for Mycobacterium tuberculosis. But our immune system have already faced those kind of TB earlier, right? Because we have already acquired the latent TB infection, right? So our memory T cell knows about that bacteria. Okay, so they immediately starts to secrete cytokine to control the situation, and which facilitates the formation of more areas of caseous necrosis. Okay, now in that time when TB is in its TB again get the chance to infect us, that means reactivated TB infection, they tend to cavitate the lungs. Okay, and allow bacteria to spread through either airways or via lymph or lymphatic channels to other part of the lungs, causing bronchopneumonia. Okay, understood? That I want to told you that in case of primary infection, they only rely on the particular part of the lungs, that is our lower lobe of the lungs, right? They only want to reside on the lower lobes. But after once immune system gets compromised, they get the chance to spread again. So under such circumstances, their now focus is to cavitate the lungs. Okay, so that the bacteria can get the chance to spread through airways and lymphatic channels, okay, to other part of the lungs, causing bronchopneumonia. Okay, not only they will only follow the way of lymphatic channels or airways, but they can also follow, or they can also choose to go through the vascular system and can infect every other part of the tissue that is present. Okay, and facilitating a special type of complication known as systematic miliary TB. Okay, so I think you can understand that once immune system walled off the entire mycobacteria, they are still dormant and alive inside that barricade. Okay, now once immune system gets compromised, that may be due to aging or AIDS, the gone focus become reactivated. Okay, and under such circumstances, they are now first preference is to spread to the upper lobe of the lungs. That can be one upper lobe or both upper lobe. Okay, now after that, they doing this because upper lobe prefers a greater oxygenation, and being a aerobe, it is preferable for them. Okay, now memory T cell already knows about them, so they immediately starts to secrete cytokines to control the situation, right? Now, which facilitates more areas of caseous necrosis in the lung. Now, another important thing, that under this second chance of causing the infection, their initial target is to cavitate the lungs. Okay, so that they can spread through either lymphatic channels or via airways to other part of the lungs, causing bronchopneumonia. Okay, and they can also spread through vascular system, and if they do so, then they have the ability to infect every other tissue of the body, causing systematic miliary TB. Okay, and the symptoms of systematic miliary TB totally rely on what part of the tissue they infect. We will going to show this. That can be the possible symptoms. If the TB gets to the kidney, it can cause sterile pyuria or sterile pyuria, sterile pyuria or a high level of white blood cells in the urine. It can reach lumbar vertebra, it can cause pot disease. If it can reach to the meninges of the brain, it can cause meningitis. If it can reach adrenal gland, it can cause Addison's disease. And if it can reach cervical lymph node, it can cause lymphadenitis in neck, known as crofula. So that is the end of the pathogenicity of Mycobacterium tuberculosis. So if we can take, if we can try to recapitulate the entire thing. So first thing is, Mycobacterium tuberculosis gets the entry inside our body due to our inhalation, right? So they enter inside our body along with the air that we have breathed in. Okay, now inside the lungs they will go to the deep airways and especially in the alveoli, right? And in the alveoli there are alveolar macrophage. The macrophage will immediately ingest those Mycobacterium tuberculosis. Okay, and as a result Mycobacterium tuberculosis gets a house to live in the macrophage. Okay, and what is the name of this house? The name of the house is phagosome. Okay, now initially or normally macrophage try to fuse those phagosome with lysosome, and lysosome contains digestive enzyme, right, which causes the destruction of the mycobacteria normally. But he is mycobacteria, so he will try to do something for its survival, right? And in that particular position mycobacteria secretes a special type of protein called tuberculin. This tuberculin prevents phagosome lysosome fusion. Okay, and along with that we have talked about sulfatides. This sulfatides is a virulence factor that also help mycobacteria to survive in the macrophage. Okay, once they ensure their survival, they start to cause localized infection. Okay, and we have named this initial situation as primary TB. Okay, now our immune system will comes into the picture and they will immediately surround the area of TB infection or site of the TB infection. Okay, and creating a granuloma, and this granuloma is nothing but a initiative to prevent bacteria from spreading to the rest of the part of the body, right? Now the tissue inside the granuloma will undergo caseous necrosis. Okay, and which facilitates a formation of a focus known as gone focus. Okay, now TB can get into the hilar lymph node. Okay, it can be get to the hilar lymph node either through either by immune cells, through lymph, or by direct extension of the gone focus. Okay, and in the hilar lymph node they undergo caseation. Okay, this caseating tissue and associated lymph node are collectively called gone complex. Okay, these gone complex are known as these gone complex are subpleural and they occur in the lower lobes of the lung, I have told you. And now the tissue which is surrounded by the granuloma undergo calcification and fibrosis. Okay, which facilitate a scar tissue containing formation which we have named Ranki complex. Okay, now the immune system can kill the mycobacteria. Okay, and only the scar tissue remains, or there can be another possibility where immune system surrounds the mycobacteria but mycobacteria inside that still alive and dormant. When immune system gets compromised, that can be due to AIDS or aging, the gone focus gets activated. Okay, and this kind of situation is known as reactivated TB infection. Clear? Now those gone focus now will target the either one or both of the upper lobe of the lungs. Why they are doing this? Because upper lobe will prefer a good oxygenated condition, and that is required for bacteria like Mycobacterium tuberculosis because it is a obligate aerobe. Okay, now their initial goal will be here to cavitate the lungs, right? although already our memory T cells start secreting cytokine to control the situation. Okay, under such circumstances, what is going on? There will be multiple areas of caseous necrosis, and that is obvious because immune cells try to control the situation, right? And now they will cavitate the lungs, and either via lymphatic channels or by direct airways they will spread to other part of the lungs and causing bronchopneumonia. Okay, and another situation can be possible where they can go through the vascular tissues or vascular pathways. Okay, and if they take this road to spread, okay, so under such circumstances there can be a possibility that each and every part of the tissue in our body is now at risk, because they can go to any part of the body, and such type of condition is known as systematic miliary TB. They can go to kidney causing sterile pyuria or high level of white blood cells in the urine. They can go to lumbar vertebra causing POTS disease. They can go to meningitis of brain causing meninges. They can go to adrenal gland causing Addison's disease. They can go to cervical lymph node causing lymphadenitis in neck, which is known as scrofula. Okay, so that is all you need to know from Mycobacterium tuberculosis as a pathogenicity. Okay, so I hope you have understand this video well. In the next video we will going to discuss about the diagnosis of Mycobacterium tuberculosis. Till then friends, bye bye.